Okay, so we're going to talk about the use of the Explorer first. I've got the tissue pulled back so that you're going to have better visibility from where you're at. To find the correct working end, what you do is you pick a premolar in the area that you are getting ready to work in, and you just stick the Explorer straight in there. What we're looking at is the terminal shank. So I'm going to show you this one versus the other end. And see how I'm using my fulcrum still as well. So this is the correct end sticking straight in there. What we are looking for with this terminal shank is that it is parallel to the long axis of the tooth, that it is straight up and down, that it is up and over the tooth. And another way people like to think about it is that if this bend is going toward the back of the mouth or toward the ear, as opposed to incorrect, where we stick it in there and it wraps around the front of the tooth. The bend is going out of the mouth. So that is incorrect. This is correct. And so then when we explore, we use a walking stroke. And so I'm going to start on this distal line angle first. We're going to always use the tip few millimeters of the Explorer, the side of it. You start on the distal line angle and you do what's called a walking stroke, up and down. And then you start rolling your fingers so that the instrument goes into the interproximal without poking the tissue. So you've always got to make sure that you roll quickly. And then I want you to give several good strokes in that interproximal so that you make sure that you're checking it thoroughly. Then you come back out, go to that distal line angle, and go across the front. Roll, and do the same thing. So examples of different types of strokes. As we go into the distal, we've got a vertical stroke right here. As we go across the direct facial, I use more of an oblique stroke where it's a little bit of a diagonal. But with some instruments, you're going to use a horizontal stroke too. So know that there are three kinds, but I typically stick with a vertical and an oblique. You want to make sure that you are truly going up and down and covering enough surface area. If you just slide across like this, you're going to miss the calculus because you're only exploring in one line rather than covering more areas. So I'm going to go ahead and start in the back. You start on the distal line angle and go up and down across the front. See how I'm using a fulcrum the whole way and how my wrist really isn't moving. Most of what I'm doing are finger movements, moving my fingers back and forth. I've got my fulcrum on there and I've got my pinky finger up next to my fulcrum. And I'm just going the whole way across. I'm making sure to get fully into that interproximal. And then I would be sitting in my surface toward position for those areas. Now as I'm getting closer to anterior, I'll be turning the mouth a little bit more like this, where they're straight up and down. And I'd end up scooting my chair more to like the 12 o'clock area. And so then as you go across, when you explore, once you get to the anteriors, you start more at the middle of the tooth. And then you roll much sooner because they're thinner teeth. And then at the midline is where you flip the instrument. So you switch ends because this other end is going to be the appropriate end for the other side of the mouth. And so if you're never sure, or you're not sure, or you're uncomfortable figuring out the working ends, the key tips, like I would much rather have somebody take the time to figure out the end than just going blindly and guessing. So just make sure that you've got your chair position in the right spot and that you go to where you're planning to work first and check it where you are working to find the correct end, up and over.